in terms of millennial healthcare professionals, their ambitions, how do we think those are different from previous generations of healthcare professionals?
I think, so the way I experienced it, I'm a junior doctor and I started a company, but I think I feel like very, very few of the consultants seem to be happy in what they're doing and how they're doing it. And I don't know if you can agree to that. But I feel like you look up and you see people that are deeply unsatisfied by the system and how things have gone. And I feel like there's a big sort of younger doctors and medical students are not, they see that there's no future. If we continue like that, there's no future for them. They look up and there's they're sort of ready to make a change, and they're much more aggressive about it. So every time I did fracture clinic and I have a number of students in the room, I ask them, so who's going to do medicine? Who's going to become a doctor? And if you have 5 of them, you've got 3 that are sort of yeah, I think I'm going to do it. And then you have at least 2 that are saying, I'm not going to do that. Look around you, who's happy? And I think for those 3 who are going to do it, they're not going to accept the systems as they are. They're going to be much more proactive at changing them, at pushing boundaries, and it's going to be incredibly exciting.
Healthcare professionals themselves, their jobs are now very much blurred. They overlap, whether it's nursing auxiliaries or nursing people or high level nursing staff and nurse specialists. All their jobs are very interrelated now to medicine. So looking at workforce is slightly different than what I was used to, which was hierarchical, where you were the boss and you made the decision, for example. Now everyone's having a say. It's more of a collaboration that we're dealing with. And that's changing. I think all those need to be understood in the context of improving healthcare innovation.
What about millennial patients? I mean, what do we think are their needs? Do millennial patients have different needs from patients of other generations?
If you talk to a GP who works in a practice with a relatively young population, and I work with a number who tell me that they're surprised if a patient hasn't Googled their symptoms before they come to see the doctor and already has a very good idea of what they expect and what they want the doctor to do. And sometimes that can be good, and sometimes that can lead to an awful lot of discussion and time spent explaining things that previously wouldn't have had to be explained. So I know a lot of GPs don't like it, but it's unavoidable. I mean, it's what's happening, and it will continue to.
Yeah, I mean, when I first went to the NHS with just the idea, I had no idea about the business, but to the NHS and said, I want to build a social network for patients. And they said, well, people with long-term conditions are generally over 40 and they don't use the internet. Obviously that's a complete, even at that stage, which is sort of 6 or 7 years ago, was a complete nonsense. But our kind of average age is, I think our mean age is about 52 in the platform. And it's people right up into their late 70s. Actually, so once you get to 80, there's a bit of a drop. But it's pretty much, I think that idea of age, you need to be a certain age to use any kind of well-made technology is a bit of a fallacy these days.
Mm-hmm. I'm sure we all probably agree that a well-informed patient is like a good thing, right? So the consultation hopefully can be a more effective use of time with good questions. Claire, I'm really interested in what you were talking about, where you said some GPs might not like the fact that they've got this information. When you get that kind of feedback, when you get a sense of that, is it the older generation who are more against the informed patient? Are the millennial healthcare professionals actually,
I think the challenge is, I actually work with quite a lot of tech enthusiast GPs, being a technology company, and quite a few what I would consider young GPs, and they're usually in their 30s with a few years experience. They've recently become partner, and they're very interested in technology, but the time they have to see each patient is very, very limited. It's a few minutes per patient. And so if all of that time is taken up having to discuss, I think it's incredibly important that patients are informed, and they need to be more well informed, and the internet is how they're going to be informed. But it's a challenge and a real friction for these doctors how to manage that.
I think there are real opportunities. I've said the negative, but actually the positive is, to your point about people living with chronic diseases. We know, for example, rare disease populations have been massively empowered by being able to connect with each other, and then actually that's helped drive the research and ultimate treatment of some of these diseases that even 10, 15 years ago were untreatable, because finding those patients across, a country was very, very challenging, even with, rare disease centres, through better diagnostics. And so, that empowerment and pulling that patient into that journey, I think they're one of the most engaged patient populations. And that's where a well-informed patient is so useful for, not useful as a partner in, the research and development, for example, of new therapies. Having an engaged patient involved in that process is absolutely essential.
I suppose, however high quality the information on the internet, that doesn't guarantee that patients will be reading things that are relevant to them. So people will still self-diagnose with something that may be quite different to what they actually have, for example. So I think that's always, that remains a challenge, however high quality the information. But it's also a very positive thing in many ways, and I have, because it's very relevant to what we do as a company, read many stories of patients who, with rare conditions, for example, who've only been diagnosed because they have sifted around on the internet and sought maybe multiple opinions and found a doctor who they think will be able to diagnose them when perhaps many previous encounters haven't been fruitful. I think I was reading that the average patient with a rare disease in the US, it takes over 7 years for diagnosis, and more than 5 years here in the UK, and with an average of 8 healthcare professionals seeing them on that journey to diagnosis. So if you can speed that up, because of course as a patient nobody is has greater need to get to a diagnosis as quickly as possible than you. So, of course, no one's going to spend the amount of time sifting around through the information as you're willing to. So, it's very positive in many ways, but there are big challenges.
I think we need an infrastructure in place which allows doctors to adopt new technologies to use for patients. The current system, I can only give my clinical experience within the NHS, is very rigid, it's very old school, it's very backwards. Regardless of there being countless types of technology out there, we can't employ it to help the patients. There are companies which I could create an app right now which could solve a lot of different problems, could speed up waiting times, could help the patient get seen earlier, but I can't implement it. So I think there are lots of barriers that exist in the current system. So regardless of whatever technologies and processes we want to employ, we need to get rid of those first, and by getting rid of those, then we'll be able to reach our patients more easily. And I think that's the first step that we need to get to really facilitate the current millennial patient.
Well, maybe we can start here by building on Heba's points and looking at barriers to innovation within healthcare. What other barriers do we see within healthcare at the moment?
Healthcare is very risk averse. I think the above everything else, do no harm. And when that's your motto, then the motto of entrepreneurs, I think, is something like fail fast and break things. It's a sort of disruptive technology and so forth. And there's a real friction there. It's two quite different worlds.
Yeah, I think the emphasis that has been put on innovation in the NHS is I think gone way beyond the kind of tokenism that it was probably 5 or 10 years ago. And there's a huge amount of resource put in. I think there's some cultural sort of barriers across healthcare, which is going to be a problem. I think one of the big problems is also infrastructure, in that it's just, you talk to any of these companies that are doing the defragging of the system, and there are 300 systems in a hospital that you've got to kind of wire up into one kind of situation. That just isn't a kind of 2 or 3 year job, it's like a 10-year job. And there are these amazing examples of where you've got a whole system working together as you described. I think in Salford and Manchester, the integration of their data enabled not just healthcare but industry to do some just amazing work, because they're getting that population level data in one place and actually being able to sort of find completely new approaches to lung cancer and things like that. But I'm really optimistic. I have to say, and I've told them this, I was slightly sceptical about the NHS Innovation Programme. It's been incredibly good, and they're deadly serious about driving that change. So something's going to happen.